Good evening, ladies and gentlemen. My presentation has to do with myocardial infarction, but before I go into diving deeper, the number one cause of death in the United States today is cardiovascular diseases, and we all know that. But more specifically, is myocardial infarction or heart attack, or known as MI. How many in this class, how many people know if that EKG or ECG or electrocardiogram reading is normal or abnormal? Let's start from there. How many people think is normal? Raise your hand. Okay, so nobody thinks it's normal, which is great. We have a base start. So let me give you a little outline of what we're going to go through. We're going to explain a little bit what myocardial infarction is. Then, of course, we're going to talk about the causes a little bit and signs and symptoms. There's a classification for it as far as how bad the symptoms are, or what situation or what level of injury myocardial infarction is happening at. You have the diagnosis via electrocardiogram reading, because exercise stress testing does work to find out who has MI or doesn't, with pretty much most of the cardiovascular diseases that have to do with heart or cardiac muscle, basically. We're going to talk a little bit about nutrition, not so much, but just to kind of touch up on it, a little bit about lifestyle and the stats behind it. I do want to talk a little bit about exercise guidelines or the rehabilitation part of it, which happens post-myocardial infarction. The treatment of it, medications that we use to help patients recover. And we're going to look at, it's not an article, it's more like a research study, 2 research studies, which is massive for a lot of people, and what they found out, and we're going to sum it up in citation. So, what is myocardial infarction? As you see in the picture, it is a plaque buildup in mainly coronary arteries. You do have it on the right side or anterior right side of the heart, and then you have it on the anterior left side of the heart, anatomically speaking. But I'm going to show you a better picture of it so you can understand better. But once the plaque builds up, obviously the blood can't get through. You have problems as far as oxygen delivery, nutrients delivery. So there's a problem with circulation. Obviously the blood pressure will change at that point. There is an injury of the cardiac muscle tissue because of that lack of transferring of the oxygen and nutrients. So once the plaque builds up and it gets to the point that the muscle tissue dies, then it is an injury of that section of the tissue. So there's different levels of injury, as we said, because once the plaque builds up out of the cholesterol and fatties, what happens is, in the beginning of it, it's kind of, the plaque is kind of elastic in a way of speaking. So yes, the stuff such as oxygen, nutrients, stuff like that gets through, but there is a problem as far as how fast the blood gets through and stuff like that. So it does change the blood pressure, as I said earlier. And the death of muscle tissue, as it's called necrosis, or the death of the tissue or cardiac muscle. And this, as a result, if the plaque is hardened and it's blocked all the way, then death is the result. Now, how fast can that person get to the hospital, or what type of surgery is it done right away, then it's really good luck at that point. So just looking at it a little bit closer, I took this picture from the Anatomy of Physiology book. So you do have the coronary arteries going toward the right side, toward the left side. You have the circumflex arteries, and I'm going to show you in the next slide where the blockage basically happens and where the problem begins when the nutrients are trying to get through. So this kind of gives you an idea of the coronary blockage sites, but this is the picture when you take the heart away and you look at the coronary arteries a little bit more specifically, where you see, I would say, number 1 and number 5. That's where the blockage usually tends to happen, and starts from there, and then once it's blocked, then lack of oxygen, then death of muscle, cardiac tissue, right? So the causes. Let's talk a little bit about the causes of MI or why it happens. Once the plaque builds up, which is because of high cholesterol or high fat, or in some diet routines as a result of high sugar, it causes the plaque to build up. So it could be genetic in some cases, but mostly is through lack of physical activity, which causes the obesity. We know that it is, some of it genetic, but mostly it's because they're not following the right lifestyle, they're not following the right diet, and they're not exercising. So we need to push those lazy people to the gym and put them on a treadmill. Smoking, huge cause of it, because of the toxins that get into the bloodstream, and it's a combination of diet and smoking and drugs, but smoking has an effect on building up the plaque and causing the delayed transferring of nutrients. So cocaine is another cause of it. It's actually when we look at the stats, I feel like cocaine and smoking is pretty much the same percentage, but who goes for which one, who knows. Genetic, it is a genetic base disease. You do have, the gene molecules that are just incompatible and cause a heart to go in the wrong direction as far as heart beating, contracting, circulation, and the pressure. Gender, more specifically talking man and woman, man over the age of 55, woman over the age of 65. I hope I said that right. It is common, but we're going to find out later in the slides who wins, either man or woman. So age comes after gender. I mean, it is a big cause of heart attack. So in most cases, as you get older, of course, the system starts running out of service, and you need to maintain it. But it's really important to follow the right lifestyle, right diet, and correct format of exercising throughout your life. So it's a continuing progress to help avoid this type of diseases, specifically myocardial infarction. Family history goes back to genes. It's pretty much related, same thing as, like father, mother of someone, or grandfather, grandparents, who has it. Is it the first level family? Is it first class family or second class, or what's going on? But family history and genes definitely has that good portion of cause of myocardial infarction. Talking a little bit about signs and symptoms. As you see, this person that I have up here is a little bit colorful because these are the points of pressure, pain, discomfort, and this is how you can tell if somebody has heart attack, but not directly. It's kind of like more like guessing, but if the pain gets worse, if there is discomfort, then you can tell. There's, of course, chest pain where the heart sits, because that's when the main problem comes from, the coronary arteries. You have the jaw problem. I'm assuming because the circulation goes, toward the brain, and there's a problem around the neck area as well. You have the arms. I believe it's because of the brachial arteries, if I'm not wrong, because there's a great amount of circulation toward the arms as well. So once the heart pumps out, the blood gets kind of is trying to get through the arms to kind of deliver the nutrients. There's a delay in that, so you do feel pain, numbness, and discomfort in your arms. Not so much in legs. Not so much in legs. Shoulders, you feel it, definitely. You have a sensation of fainting or nausea. I didn't see anything for headache, but I'm assuming, if your pressure is off and you can't get the blood through the system, you're definitely feeling something in your head, because it's going through your neck and jaw. You definitely have to have a headache. So shortness of breath. There's a breathing problem. Obviously, when you have a discomfort in your chest where the lungs are, you are definitely sensing a problem with breathing. And if you go to those websites that I have below the page, you can see more details. I just put it down there for a little bit of a citation. So classification. There's ST elevation, ST segment elevation. We're going to talk about the EKG part of it a little bit more in depth as we go on, but they call it STEMI or STEMI or something like that. I'm not that far into the medical part of it yet. But non-ST elevation MI, you have the ischemia, you have the injury level where, there is rupture because of the plaques, and there's a problem as far as the blood going through. Of course, there are demands. The oxygen doesn't get through, so there's definitely injury at that point. And then going a little bit more extreme, necrosis happens, which is the death of the cardiac tissue, and as a cause of that, of course, death. Now, in a couple of other presentations, there was a mention about the electrical conductivity of the heart. I think it was your presentation where the athlete just dropped because of the sudden cardiac arrest, and because of that cool system that he had in his body, he just kind of restarted the heart. So you can use that in this situation, but if it's extreme and the plaque is built up, I think the best way to go by that is the surgery. We're going to talk about the treatment part of the myocardial infarction, but the bypass or the balloon it's pretty much the best type of doing it right away, of course, as an emergency. So ischemia happens due to plaque rupture. Yes. There is injury because the high demand, for oxygen, and there's less supply because of the plaques. Sudden, unexpected cardiac arrest. That's something that happens in most cardiovascular diseases, because of course heart is involved. And angioplasty is another type of treatment, but again, we're going to get into that. CABG, I'm going to explain that a little bit further. But just starting the electrocardiogram, or EKG, or ECG, I think ECG is more European and EKG is more American. I don't know, I'm just saying, but it just sounds that way. So when we dive into it and we look at the different jumping of the EKG and stuff like that, I'm definitely not a professional when it comes to EKG reading, but as you can tell, you have your P, then from P to R wave, which is the one all the way on top. You have the PR interval. You have your QRS complex, which is normal. Then you have it dives in, picks up, and you have the T and U wave if it's a normal EKG reading. So going forward, that's just wanted to refresh your mind. The interpretation and what does it have to do with myocardial infarction after an exercise stress testing. Once they review the results, they can tell if, as the person is on the treadmill, is experiencing a problem. So either the exercise stress testing gets terminated, or they cool them down easily and get them off and continue with the interpretation. So ischemia is pretty much has to do with inverted T wave. Please correct me if I'm wrong, because I'm not 100% sure when it comes to EKG. Brugada syndrome is hereditary, if I said that right. It is characterized by right bundle branch block. I got this information from the textbook from the EKG interpretation, the orange one. It's a very good book, and I call that EKG interpretation for dummies. ST elevation is common in leads of V1 to V3. Pericarditis, ST segment is elevated. So the ST segment section of it is definitely elevated in pericarditis. So as we go through electrocardiogram, there are a couple of things. I mean, there's different type of myocardial infarction, and they happen in different locations of the cardiac muscle tissue, either anteriorly, laterally, or posteriorly, because of the different arteries. You're looking at subendocardial infarction or ST segment depression. Please stay with me. I know it gets a little boring when you go through EKG, but necrosis, the absence of Q wave, anterior infarction, which happens anatomically in front of the heart, is the V1, V2, V3, and V4. As we know, we set them up on the left side of the body, one by one, and as far as electrodes. And it is the ST segment elevation in all four leads. Okay. So lateral infarction happens in I and AVL. Inferior infarction happens in leads 2, 3, and AVF. Acute it has to do with like how recent the MI is, or how new the disease happened, something like that. It happens in lead V1, V2, and there's definitely ST depression. There's no elevation in this one. Okay? So posteriorly depression. So I picked up just a little EKG reading. Again, if you see something wrong, please let me know, because I'm not 100% sure. But as you see the blue part, that basically identifies the lateral section, and the red part anterior and septal, the front or inferior, which is the back of it. And the breakdown, I don't know if you guys can see clearly, but in the chart, basically it breaks down what I told you before, if it happens in V1, V2, V3, or in the other leads. A little bit of nutrition. My beautiful picture from Google. You definitely need vegetables and fruits. I mean, it's huge. They were talking about 5 portions a day minimum. So people who follow a vegetarian diet, I want to say they have a greater chance to not get a heart attack if it's not genetic. But you definitely need to maintain your vegetables and fruits. Yes, you want food in high fiber. I didn't dive into it as far as like the percentages of calorie count or how many portions. I looked at vegetables and fruits. Protein, they're talking about, when I say day, the standard of pretty much, or registered dietitians speak of 30 to 40% protein, 30 to 40% carbohydrate. They want you to lower your carbohydrate intake, and they definitely want you to lower fat. So you concentrate on fruits, vegetables, and protein aspect of your diet. Lower your carbs and fat as much as you can. And you'd see a couple of other, whole grain products, dairy products. They're okay. You definitely want to consult. As far as the lifestyle part of it goes, you definitely want to be in a consultation if you are an MI patient. You want to limit your cholesterol because that's how the plaques build up, I guess, and the fat. And they said limit your iron intake. I'm not 100% sure why, but I think the females also have the more intake of iron, if I'm not wrong. And I'm not really sure how would that affect it, but I guess we'll find out. Myocardial infarction lifestyle statistics, just a little bit of a statistic as of 2009, 2010. Smoking holds about 30 to 36% of it as of end of 2009, which I'm pretty sure is increasing. Obesity on the rise. As of 2009, it was 20%. I bet it's probably doubled by now. Lack of activity. We all know people are lazy, they don't want to exercise, and that's why we're in this major, right? So job stress holds a little bit of this percentage, and you'd be surprised when I go toward the summation of what happens and what day people usually experience the heart attack. Alcohol. We all know alcohol is good to party with, but it's bad to intake as far as cardiovascular diseases. The guidelines say it is okay for males to have 1 light drink, for females 2 light drinks per day, and they did mention wine drinking is okay, but alcohol on a regular basis every day, not so much. So as you see, it holds about 9 to 10% as of 2009, and I don't know what the stats are now, but that's pretty recent as far as the stats go. Poor diet, that goes back to obesity. We all know that this country is pretty much based on fast food. People want to just grab something and go, and that just grabbing something and go is pretty much causing their life. So we definitely want to, as health and fitness professionals, we definitely want to concentrate on advising our clients about the lifestyle, diet a little bit or more, and continue with their exercise, because these are the stats and they don't look good. So myocardial infarction exercise guidelines, or pretty much what happens for the cardiac rehab portion of it. I'm not talking about who just walks in the gym and wants to work out. This is a supervised, monitored exercise program that pretty much they go pre, during, and post-exercise, and they monitor the patient heart rate, blood pressure, EKG reading, or whatever is necessary, and of course the intensity. Because when it comes to the patients for MI, especially for their post-recovery, intensity is a huge factor. Duration is huge, and of course you want to talk to them about the breathing techniques and stuff like that, but you want to make sure that it's definitely low intensity on the lower part of it, depending on how recent the MI happened and how old the patient is. As I said, it is supervised. These exercises usually take down or happen on treadmill, unless somebody has a problem walking on the treadmill or with the Wingate, so they place them on a bike, seated bike. That's But all we're trying to do is to get them to become more active. But it, of course, monitor like low intensity and stuff like that. Some people, believe it or not, have a problem of maintaining it even for 2 minutes. Now this could be post-surgical situation where they have the bypass and they don't feel good, and sometimes they feel dizziness and stuff like that. So you definitely want to watch out for that. Stretching and flexibility is optional really if they ask for it. Little bit of just the guidelines when it comes to cardiac rehab. I'm pretty sure if Dr. Mahadi was here, he would mention this. It is a lifestyle advice. You definitely want to continue consultation with the patient to make sure they're on the right track. It is progression training, not just the exercise portion of it, but the lifestyle, because some people tend to go back into their old habits, like drinking, smoking, or bad diet. Stress management, you definitely want to talk to them about that and make him feel a little bit happier and positive, because that does change a couple of things. Nutrition consultation, it's huge. We know that when you want to get results, fitness results or health and fitness results, it's 70% nutrition, 20% exercise. So you gotta talk about the nutrition part of it. It's huge. Social support, when it comes to your friends, family members, how much of a support you have in gaining your strength back and trying to recover from an MI, which is a very serious disease. Supplementation, you want to monitor that. It's huge when it comes to protein intakes. If you're exercising and you're part of a younger age and you want to do creatine and stuff like that, you really got to watch out for it, especially with the caffeine intake part of it. Again, I don't know about the details, but you definitely want to monitor that. Talking a little bit about the treatment part of the myocardial infarction. Reducing pain. Now, how do you want to reduce the pain? It could be through a massage, pain management, or whatever that case may be. Improving the blood flow. How do you do that? A little bit through exercise, a little bit through diet. It is hand to hand. Oxygen therapy, I'm not really sure. I didn't dive into that to find out how they would do that, but I'm assuming by intake of oxygen through like a capsule, not really sure, like a tank of oxygen, something like that, or breathing technique. But cardiac monitoring, again, it is in cardiac rehabilitation. I'm sorry. So when we're going through the medication part of it, all the medications that I listed is pretty much, there's something common about it. It is, there are blood thinners because, again, we want to increase the blood flow. Okay. I went over 2 research studies, just to briefly go over this one. It was 22 randomized trials of rehabilitation process. One of them achieved a significant result. There were 4,500 people in it. 3 groups, trained, 1 3-year group and 1-year group. Okay, separate those. And 3-year group did the rehab, 1-year team did the, it was the comparison group. And the result of this study was that, you know, it's pretty much going back to rehabilitation programs working for post-recovery. Okay. This is another research study. It's quite similar. It was really hard to find a research study for it, but again, mortality rate, it's trying to find out the mortality rate in treated patients, 10 randomized clinic trials, sample size between 4,300 patients, control group 2,100, rehabilitation group 2,200. Again, the results of this was post-recovery from MI is definitely showing a good, how do you say it? It's a higher benefit through the cardiac rehab program post-MI. The summary, 1,000 people daily die out of sudden cardiac arrest, but that has to do with his study more. Negative emotions and depression shows a great amount of MI side effects. 6.5 million Americans suffers from angina or at least the symptoms of the MI. 40% death prior to hospitalization. MI usually happens on Mondays mornings, either before you go to work or during your work, and on Thanksgiving. So watch out what you eat. Man win over woman in MI stats, as CDC mentions, and African American race is more prone to myocardial infarction because of the genetic or heredity background situation, and that's my reference. I'm done.